Here at Rehab Solutions, we provide advanced physical and occupational therapy services designed to help our patients maximize their quality of life.
Hey guys, my name is Tiffany Nielsen and I'm a board-certified clinical specialist in orthopedics. I'm here to talk to you today about 3 things that I have found super helpful for patients preparing for a total knee replacement surgery. Let's check it out. So, first thing most people don't think about is seeing therapy prior to surgery. In physical therapy, we call it prehab. Research shows at least 1 session of prehab increases patient satisfaction after total knee replacement surgery. Tell your doctor you want to visit with us about 1 month before surgery to go over expectations and get as strong as you can prior to surgery day. Second is icing. Icing is key to improve swelling, motion, and strength gains after total knee replacement surgery. Our approach is icing every hour for at least 20 minutes for up to 3 weeks. Third is obtaining full knee extension as soon as possible after surgery. This is important because if you can't get full knee extension, it can limit your ability to get a full knee bend, impair your balance, and be more taxing on your muscles when walking. We recommend getting your knee straight at least 5 to 6 times a day for up to 20 minutes. Thanks for watching, and we hope this helps in your upcoming total knee replacement surgery.